Good evening and welcome. And I just want to thank you for joining us for our second webinar in our mental health series with Mental Health America, titled Mental Health and Pancreatic Disease. My name is Adriana Cowdin, and I am the Interim CEO and Executive Director from the National Pancreas Foundation. And like many of you, I too live with pancreatic disease and know the toll it can take both physically and mentally. And I'm going to share a little bit of my story later on tonight in some comments. We all hope that this webinar will teach new coping techniques, provide some new resources, and let you know for sure you're not alone in this fight. And I know just how important it is to know that. A couple of housekeeping things: the webinar will be recorded and it's going to be uploaded to YouTube on our NPF channel by Monday. You can find all other resources, centers of excellence, and support resources at pancreasfoundation.org, which is the NPF website. And we'll be sending out an email after the webinar with the link to watch, as well as the resources mentioned tonight. If you have any questions, please add it to the comments in the Q&A. We'll be taking comments mostly at the end, but we will get some during that. And then tonight's moderator will be our Mental Health Association America's Chief Social Impact Officer, Dr. America Paredes. In this role, she leads the implementation of Mental Health America's forward-thinking and equity-focused approach to change by developing and implementing innovative partnership strategies through a social impact and systems transformation framework to advance their work through measurable change, collective action, and things like tonight, community engagement. Thank you, Dr. Paredes and Mental Health America, for your time, support, and partnership, and I will turn it over to you now.
Thank you so much, Adriana, and hello, everyone. How is everyone doing? I hope that you are finding yourselves in a comfortable space to engage in conversation today. I am joined not only by Adriana, but also Dr. Pandit, who's going to help us bring in the professional perspective of helping individuals who are living with pancreatic disease and illness. But, I want to tell you a little bit about who we are at MHA. I am Dr. America Paredes. I don't know why my name says differently, but that's okay. I use she and her pronouns. And as Adriana said, I am the Chief Social Impact Officer for Mental Health America. And Mental Health America, if you have never heard of us before, is a national mental health nonprofit located outside of DC in Alexandria, Virginia. We have been around since 1909. So you can imagine we've been doing this work for a very long time. And in my role, as Adriana said, I really work on creating innovative strategies for us to get out into the community so that we can not only help individuals who are living with mental illness address the range of different needs they may have, but also helping individuals understand that when we struggle, we shouldn't be doing that on our own. And if you're struggling with your mental health, it is completely normal to do so. And part of the relationship that we have and partnership we have with NPF is to really engage a little bit more in understanding how we can help support the needs of individuals who are living with pancreatic disease, and within that realm, also help develop some resources that may be useful to you. So tonight will be a point of conversation. It is a second series in the mental health series that we're doing with NPF. The next one will occur later in the summer on the Mental Health America website. So if you haven't joined us before on that side of things, please follow us at mhanational.org. So what I'm going to do a little bit of a recap for you all is to help you understand how we even started this relationship. We've been working with NPF for a number of months now in helping everyone really get a foundation of what's happening within the world of pancreatic illness and pancreatic disease and the realm of all of that spectrum. And we've done a couple of focus groups with folks living with pancreatic illness, and then we also talked to professionals. And from those conversations, a couple of things became very apparent. One, we know that the physical limitations that exist with pancreatic illness impact mental health. If that hasn't been the case for you, that's amazing. But most often, I think it's such a common theme that comes up in all the conversations that we have. The other is that support systems and caregivers are essential within the spectrum of that journey, from early diagnosis or misdiagnosis all the way through when you're living with the disease on a daily basis. A couple of other things that have really been important to identify and highlight is that there has a continuous struggle to find mental health providers who are knowledgeable of individuals living with chronic illness. That in itself is a major barrier to treatment, even more so when we think about other barriers like cost or transportation and a range of other factors. But beyond all that, what we want to spend some time doing today is really focus in on some of the findings that we have from the survey that was completed. And we're going to then spend some time having a conversation with Adriana and Dr. Pandit around all the kind of findings that we had. The survey that we sent out which was just about a month ago, we got so much important information from that, from folks that are hopefully participating tonight, and if not, at another point where they can access the recording. We had about 60 responses from individuals, and a couple of things came through. One, we know that mental health impacts are evidenced across various factors. And what I did is kind of pulled all that information together into 4 key areas. One is emotional changes, everything from the fear that you may feel, the grief that you experience throughout the cycle of disease and illness, the depression, anxiety, and X number of mental health conditions that are within that realm. Additionally, there are social factors that are impacting our mental health, and that is everything from isolation, the fact that you may feel you are a burden to others in the struggle that you're living with, and primarily a loss of identity and understanding what is that, what am I supposed to be, who am I supposed to be with this illness, what about the dreams that I've had that are fairly uncertain at this time. The third factor are physical factors, everything from pain, nutrition, the overthinking about how it is that you're going to manage the illness, and the uncertainty that also comes with that and how that plays out in your daily life. And then the final factor is really the unforeseen impacts of the illness, everything from the financial stress, loss of a job, loss of family connections, and within that, how all together it comes to influence our well-being on a daily basis. So we're going to talk a little bit more about some of the other findings, but I'd love to have an opportunity to hear both from Adriana and Dr. Pandit around some of these factors. For instance, I'd love, Adriana, if you could, do any of these results that we kind of talk about resonate with you and your experience at all?
Yeah, well, thank you for asking. If you don't mind, I'm just going to share a little bit more about my story to give a little bit of background. So I won't share my whole story because it's long and complicated, but I was diagnosed with chronic pancreatitis in the fall of 2015 and spent the most of the next year in the hospital. I lost literally everything that I thought at the time mattered. I lost a career that I'm one of those people that chose career over kids. And so I had funneled everything into my career. I lost my career. I lost my Mercedes and my big house and all of this. And so I really felt depressed and anxious and hopeless, similar to a lot of the comments that we got. I lost friends. I lost some family support. I always say it was like a tornado blew through my life. And here I was left with like this broken body and a horrible disease. And I did have one bright light, which is my husband, Eric. I had met him just previous to getting sick, and he has been by my side, and thank goodness for him. But between the fall of 2015 and 2022, I've had about 30 surgeries or so. I've had 16 ERCPs. I don't even know how many EUSs. I've had the Whipple. I've also had the TPAIT, 7 feeding tubes. So what I would say is I get it. Like I live this disease and really get it. I think now is also a good time to share. I don't just have chronic pancreatitis. Like many people, I have plenty of other diseases that come along with it, such as diabetes. But I also have osteoporosis, Addison's disease, hypothyroid, hypopituitary, ITP, mild liver disease, gastroparesis, IBS, and celiac. So I have a body with like no organs and a lot of diseases. But what's really resonated with me is that I make a choice every day to get up and live my life. And that choice is something that is not always easy. And I don't want to sound Pollyanna-ish. It's not like every day I get up and I'm like, let's tackle the day. Like this morning I woke up and for no reason I was bloated, nauseous, and sick to my stomach. Like just no reason, just upon waking up. And so when days like that happen, I really make the choice to get out of bed and get dressed. You know, some days it's a ponytail and other days I can do the full shower and get ready. But I think that it's just about making that choice and really saying, today I'm going to give it my all, and whatever that normal looks like is going to be fine for me, because my new normal may be very different than someone else's. And it's certainly different than what it used to be.
I think what resonates the most from what you shared, Adriana, is the fact that there are so many shared experiences within that, right? Within one experience that you shared like snippets that could be books, I would imagine, of everything that you've dealt with. And I think that's very similar to some of our survey respondents that are not only dealing with pancreatitis, it's pancreatitis and then you have the list. For a range of different reasons, right? That ultimately are, maybe it's the start of the disease and the illness that you start that conversation and then everything else just kind of bubbles up, and in the end, you have the list. But I wonder, Dr. Pandit, I'd love to give you an opportunity to introduce yourself to everyone and then share how you kind of manage and work with folks in your community.
Absolutely. Thank you so much. And thank you for the opportunity to be here. I think what an important reason that we're all together tonight. So I'm a assistant professor of medicine at Northwestern. I'm a clinical psychologist in the gastroenterology department there. And so I am working clinically one-on-one with patients who are referred from our gastroenterology colleagues, but working with patients one-on-one in mostly outpatient work. So, you know, I work at an academic medical center, and my group has been very well established, and our medical providers very much buy into and respect the mind-body connection and the way mental health influences physical health and vice versa. And so I feel very, very lucky to be in that environment. And I understand that probably many people here tonight don't have that sort of resource of a psychologist within the same office as the medical provider. So that's, you know, a little bit about my background. You know, I'm in clinical psychology, decided to specialize in health. So the way in which mind and body are connected and the way in which we can use psychological interventions to help with physical health through primary and secondary, tertiary processes. What I thought was so, you know, interesting about what you shared so far from the survey data, which was really profound, is that all of the ways in which mental health impacts so many domains of life. I think me as a professional, you know, I recognize that. And in fact, I take this biopsychosocial approach to all of my patients and kind of help to understand how a chronic illness has influenced, you know, physiology, but also social factors and, you know, more logistical, practical experiences of living life, as well as identity. And social factors, of course. Relationships end up being a really important factor that comes up within therapy. So, you know, of course, we'll share more along the way, but I think, you know, how fascinating and spot on are those results as it relates to kind of what a health psychologist looks at and does.
I think, Dr. Pandit, the folks that you work with are very lucky in that you are very open, and not only in being willing to have these conversations and look at things across the domain of our well-being, but, you know, our survey results show that 50% of folks have not engaged in that type of relationship with their providers. And that's for various reasons, everything from fear and shame, and like the fact that they may believe that if they say something, they're not going to be taken seriously. There's also this notion that when they say something, they may not have access to the providers that they need. And I think that's a common theme that comes up with what folks have shared. There is a need to be able to have a specialization and a special understanding of how something like a chronic illness can definitely impact your overall well-being. Most importantly, your mental health, right? Like the physical realm of our existence is definitely important, but when our bodies are not doing what they need to do for our well-being, the mental health side of it is even more crucial. Adriana, do you have anything, when you shared, like you first met your husband, who's your husband now, right, before you had the illness, and that relationship that you had, I think, has been fundamental to your kind of recovery and living with illness. I'd love to spend a little bit of time from both of your perspective to talk a little bit about what you do to remain true to yourself within that, how you rely on these relationships, and see how that comes through also, Dr. Pandit, with the clients that you work with.
Yeah, that's a really good question. I literally met him not even 6 months before I got super sick. And so I always joke that like people might go on a first or second date for like dinner and a movie. Ours was like looking up lipase and amylase and ERCPs at middle of the night in hospitals. But it's not just him that supports me. Like I said, I lost some family, I lost some friends, but I built a really great support system. And that looks different depending on who it is. Like I have one girlfriend who happens to be a writer, and so she has a very flexible work schedule. So when I need to go to doctor's appointments that I can't drive to, whether they're out of state or I'm just too sick, she's someone I've really come to rely on for that. I have another friend that works from home often, happens to be close by. And so she a lot of times will pick up groceries for us or pick up prescriptions. And then this is very uncommon, but after the Whipple, I was I was bedridden for about 6 months and then wheelchair bound for about a year. And my aunt, my dad's sister, they're all from Argentina, my family is, and she literally packed up her life and moved in with us here in the United States for 6 months and took care of me 24/7. And she's done it twice now, after the TPAIT and after the Whipple. And I will tell you, even as amazing as my support system is, I still work with a therapist every week. I had a horrible time trying to find one that knew a lot about chronic illness. And so it's a therapist I had previously worked with. And so she and I have kind of learned together along the way. But I was also diagnosed with PTSD in 2017 following the Whipple. And quite frankly, pardon my ignorance, I literally thought that was a veteran's disease. Like I didn't realize anyone that was not a veteran could be diagnosed with PTSD. And so I still take depression and anxiety medication. I think it is a wonderful thing. I know people have varied perspectives on it. It took us probably 3 or 4 to figure out which one really worked for me, but I have found the combination of my therapist and my support system and medication, and then some really specific support groups through NPF and Inspire to be critical. Those support groups, I think, at least allow me to talk to other people that can relate to me and be like, hey, it's, 10 o'clock a.m. and I feel like I already need a nap because my body is so exhausted, where someone who just doesn't deal with these types of physical issues are like, who's tired at 10 a.m. or, whatever the issue may be, or the fact that I consistently feel unreliable because I'm canceling plans with friends at the last minute because I'm getting sick. Those issues are not ones that are common unless you're in these types of medical situations or physical challenges. And it helps a lot to have those support groups that are kind of verified support groups. I will share, I joined one on Facebook for the Whipple, and I finally had to leave it. It was like a lot of it was very pessimistic and how everyone who has the Whipple dies. And that's just not helpful. It wasn't helpful for me. But those support groups have been really amazing. And so I would say, Dr. Pandit, what do your patients also feel that like this combination of things are really together what creates an experience where you can kind of live effectively with these diseases or this disease.
Absolutely. I mean, so much of what you said, resonated with me as a provider. But, I think I can certainly speak to the research when it comes to this combination of medication and therapy and so many other interventions being the most effective to treat mental health. And also the fact that we know that, pain, which I know is such a common symptom, is kind of located in the same brain area that we experience depression. And so often those medications that are used for depression can help with pain too. So there are multiple reasons to think about using those kinds of antidepressant medicines that can help with changing our experience of pain as well. But it's definitely a personal decision. Everyone has a different feeling of what's right for them, and certainly respect that.
I think so many things, there's so many things to unpack from what you guys have shared, because one is this idea of finding, someone mentioned this in the survey, creating a toolbox, right? Within mental health, in the world of mental health, we definitely say you have to find what works for you. And that is different across the spectrum. So when we think about the wellness tools that we have in our toolbox, it can be medication, it can be therapy, support groups. And some folks even shared, they have engaged in exploring other alternative therapies, meditation, Reiki, medical marijuana, and outside of that, thinking about how exercise influences our well-being. I know that one of the places of struggle, right, is the fact that when we are bombarded with messaging that our body isn't doing well, it's not doing what we want it to do, right? There comes this kind of inevitable conversation that you have to have with yourself and say, what can I do with what I'm being dealt at the moment? And there's a lot of, I think you kind of touched on it a little bit, Adriana, a lot of ambivalence around, like, what am I supposed to do? Am I supposed to go down this deep, dark hole of despair and nothingness, which is so easy, right, to go into because you just feel like that a lot of the times. But then there's this internal struggle that you have to manage and say, no, I'm going to try to do what I can today. And that, I think, is evident through some of the survey responses that we've seen, that people feel that their support systems are critical, but that balance of saying, I have my support. What am I going to do? Am I being a burden to all these people that are part of my world now? So how can we help individuals understand that even if you do feel that, I want to say, that imbalance that we all struggle with, whether you live with illness or not, how do you continue as a person living with the illness, and Dr. Pandit, what can you tell others to help them continue to feel that there is a reason why they're here and managing that struggle?
Well, I have a couple tricks. Well, first of all, I always say that everyone has something. Like, mine is my health. Someone else, it might be relationships, someone else, it might be career, someone else, it might be finance, but everyone has something they're struggling with. And so that always helps me feel like it's not me, right? But I have a couple things I do. So I create vision boards, which are so like new age, but I love them. I have one right here in my office, and I have 4 in my bedroom. And I have pictures of like amazing food. I live on a liquid diet. I don't get to eat that amazing food right now, but I feel like, okay, if I have it there and I look at it, eventually I will be able to. And I have pictures of like vacations I want to take, which, as we know, with this disease can be very hard, not just how hard the travel is, but again, the eating and care if you're out of the country, et cetera, or out of state. But so I do vision boards to kind of keep not just my mind, but also my vision kind of constantly replenishing those positive messages. And then I take it one step further and I do sticky notes on my bathroom mirror that say things like, I'm 100% healthy. And I refer to myself as someone who lives with these diseases. I don't say I battle them. I don't say I struggle with them. I say that I live with them. And then the third thing I would say is, exercise your mind and your body. I do something every day to do that. And so like today when I got up and I was really not feeling well and I'm still not feeling well, I do meditation for 10 or 15 minutes. And then maybe I'll only walk a block because that's all I can make it today. But on days where I feel really great, maybe I can do strength training for 30 minutes or, walk for half an hour. But I try and exercise both my mind and my body every day because I know that like the more I can move, the better my body feels. I always feel worse when I'm like laying in bed for days on end, even if I'm supposed to be on bed rest, right? Like it doesn't feel good.
That's incredible. I think, you certainly have, it's clear to me that you've worked really hard at kind of building that toolbox up. And you mentioned so many things even so far that even, from that psychological kind of jargony sort of way of thinking about things totally fits with the way a psychologist would approach trying to help a patient to figure out what works for them. And, when it comes to that choice point of, whether you go down one path that's maybe in line with the value versus the other path that's maybe more in line with immediate comfort or, something that's more in the moment, it can be difficult to figure out how do you decide which path is right for you at that particular moment. And what tools can you use to help to travel down the path that you think you want to be traveling down if you kind of zoom out a little bit. But I think, I love something that you've mentioned, which is really connecting to what you value. So, I think clarifying the things that you really care about in life, and in whatever capacity that looks like, how do you do some of that every day if possible? Like you said, walking a block. If you identify as someone who is a caring person, maybe that care can be expressed towards people in your life, or maybe it's a day that caring is expressed towards yourself. And that's the way you express this value. So really kind of thinking about it as these traits and values that we have. And I think another thing that I'll mention is just, something that Adriana again kind of referred to is this idea of not just positive thinking, but, strength-based sort of philosophies. I think a lot of times psychology focuses on what's wrong and like identifying different problems. But there's a really good reason to focus on positive psychology or what's right with somebody. What are their strengths and how do we build those things up? How do we kind of do more of the things that someone's good at instead of focusing on what's wrong? And I think a lot of what you spoke to kind of refers to that.
I think
I believe
just get really quick, America. I would also just say that some of the less traditional methods, whether it's meditation or medical marijuana, like I have tried a lot of things. And I happen to have a sister who's got a autoimmune disease, and medical marijuana works really well for her pain. It gave me seizures. So like it doesn't work for everyone, but it does work for some people. And I think that it's really important to work with your physician and your therapist to determine those treatments that work for you. And it's not like necessarily a bad thing to try out new things. Like I would have never tried medical marijuana, but my GI was like, hey, I really think this will work. And I'm just someone it didn't work for. But like I said, for my sister, it works great. Same thing with like vision boards. It works for both of us, but meditation, she's not into and I am. So it's also very personal that I've really found help working with both my therapist and my physician to figure out the right kind of combination, if you will.
I appreciate that. One of the things that kind of stands out from what you both have shared is this idea of values, right? And oftentimes when we start this journey, there is a theme that comes through is that people feel like there's less valuable. They're seen only as the illness. And so there is a need to re-engage with that part of yourself to say, this is who I am. And part of what you said, Adriana, is like you live with this, right? It's not a battle. And that is language that is very important when you think about positive psychology. at Mental Health America, we definitely use person first language. So it's never someone that's like is a depressive person. No, it's a person living with depression. We're people before anything. And within that is the realm of all the things that we struggle with. But I think it's also critical when you think about the values that we hold and what we want to see for ourselves is within the realm of this experience of illness. Oftentimes we kind of retreat into ourselves, and with that comes isolation. And that isolation doesn't help our mental health, right? It's like a breeding ground for making us feel worse. And so there's some efforts that have to be done so that we can engage in exploring what that looks like. Maybe it is re-identifying what are the things that were most valuable to me before. Are they still relevant to my life at this time? And if so, how can I still engage with those? Dr. Panda, you said like if somebody was caring, I hope everybody on this is caring. But sometimes we show that differently, right? It comes through in different ways for us. So maybe at one point, if you were volunteering, for instance, and you can't do that anymore, is there another way for you, maybe for you to volunteer in a virtual group? These things are really important to how we see ourselves in that positive light and trying to give back to individuals. And I think beyond that, it really resonates when people say, for instance, where they are looking at the range of different things that are available to them and keeping in mind cost, right? If I don't have access to regular transportation, how can I continue to do what I need to do to feel connected to community, connected to family? And if those factors aren't there, for whatever reason, creating new community so that you don't self-isolate, right? So I think what we would want to explore a little bit more is a little bit of what you've touched on, Adriana, but Dr. Panda in your work, I know from what folks have shared, for people that are not truly in this space, that they are receiving the greatest mental health support from their providers. How can we help ourselves and how can we help our providers understand this is a conversation that has to happen? What are your suggestions for that? And neither one of you can address that.
I think certainly, again, I'm sure a lot of people here have providers that are somewhat, more inclined to talk about mental health versus not. I know even as patients, it can be difficult to talk about mental health because, well, mental health and even pain, I think it's been studied that, patients are worried to bring up pain because, they're worried that their providers might focus only on the pain and not on the treatment. And that in itself can be a bit of a barrier in feeling totally open and honest about how you're doing. I think, being is sometimes my patients find that it's easier to send a list of questions rather than bringing up during the visit prior in advance. So if there is some sort of portal system or email system where you could kind of express what you would like to express in writing, often that's a kind of a smoother transition to having the conversation in the clinic visit. Even speaking with the nurse can be a little bit less intimidating for some patients, or if there's a resident or medical student, there might be a little bit, I know medicine can feel very hierarchical, and I know everyone wants the doctor's attention for the most important things. And I think if we can shift our thinking around to prioritizing mental health as being such an important piece of the whole person and the management of the disease, then maybe it will be easier to initiate those conversations if the provider is not on their own.
You make a really good point, Dr. Panda. I am one of those people that sends a list before my appointments with my therapist. And even with my primary care doctor and my GI, I tend to it's more because I feel like I'm going to forget everything I need to talk about or whatever the most important issues are. And so I do that. I just had an appointment today with a motility specialist, and I got on the portal yesterday and sent my 5 questions and my priorities. And so I feel like that's a really good tip. and also sometimes you don't want to bring up some of those topics. And so it's easier to do, at least for me, in writing, because then I've kind of already broached it and it's easier for me to then have that conversation. But it's interesting, like when I left corporate America in 2016, someone was like, you're just gonna like not work anymore, right? And I was like, my disease is in my pancreas, not my brain. It's okay. I can still mentally function. And so I think it's interesting to almost teach other people how to treat you, because some people will just see you as a sick person and just like, you know, my saying is always, they like put you out to pasture. Like they don't know how to deal with you. They don't know what to say. They don't know how to say it. And so they just kind of ignore you or think that you need to just retire and move on in life. And it's important to figure out a way to tell people how to treat you. And even to tell people how to respond. Like some people care by baking, you know, and I mean, I have diabetes and celiac, so I can't eat a lot of things, but I always say, thank you, take the goodies. And my husband is very happy about it. And so you just kind of have to accept people and almost teach them how to take care of you or how to respond to you.
I feel like those are things that are definitely important for the conversation, and when we are at our best, that we are able to help others help us. But I know that within the realm of mental health and that conversation, there is still a lot of stigma. And I know with pancreatic illness and the range of other kind of illnesses within this area, that there is a stigma also in how you will be seen. Like if you mention pain, as Dr. Pan had said, maybe it's seen as something else, or you know, if somebody may believe that you are struggling with alcoholism or you have an eating disorder, and it's already like a layer of stigma that has nothing to do with your experience, but it's already there because of our culture. And I think where a lot of folks may struggle is in being able to say, literally say the words, I need to talk about my mental health. I need to talk about depression. And oftentimes where we struggle the most across any kind of illness is the fact that we don't have the words to be able to navigate that space. We just don't know what to say. So Adriana, what are some ways that somebody can literally say to a doctor, I would like to X?
Yeah, so I think you make some really good points, like pancreatitis and pancreatic disease is so frequently talked about that you're an alcoholic, right? Like I didn't even drink alcohol when I got it. And then of course you can't because it makes you so sick. But and then, for example, I was referred from one hospital to another via ambulance, and I was on like a PCA machine and a feeding tube and all this kind of stuff. And they get me set up in the second hospital. And the attending physician says, oh, a lot of women in their 30s and 40s have phantom abdominal pain. You should just go home. And so you get treated differently because you have a disease that's associated with alcoholism, or because you're in pain. You know, they think you're a drug seeker, and whatever that case may be. I would go back to the fact that, like, put down your thoughts before you see your doctor or therapist or GI or specialist, or even your friend that you might be having trouble with, or family member. Put those down on paper so you remember your points. And it's just a little bit easier to ask for help. Sometimes you send an email in advance, sometimes not. But I clearly remember one day I cried for like 5 hours straight. I couldn't stop crying. And so I texted my husband. I for some reason didn't even feel comfortable calling him. I texted him and I was like, I think something's wrong. I can't stop crying. And he told work, I have an emergency, I have to go. He came home, called my doctor and said, we need to get in right away. And even though it was a physician, she was my primary care doctor. She was like, you know, what is going on? What are you thinking? And what's happening? And obviously making sure I don't want to hurt myself. But for me, the most I could do in that really broken down moment was to send like a 1-sentence text to my husband. Other times when I'm broken down, and like a lot of times when I can't stop vomiting and people who have this disease know that I will call my sister, and bless her soul, because she listens to me vomit, which cannot be easy. I mean, like, that just can't be an easy thing to do. But sometimes I feel like I'm going to choke and die. And so, I don't want to alert my husband. He's busy working, and I don't want to scare my mother. And so I call my sister, and I'm like, just stay on the phone with me until this wave passes. And so sometimes it's writing, sometimes it's maybe sending a text to someone you trust, or even reaching out via phone to a trusted resource and saying, or a trusted person and saying, I need help, like, I know I'm not going to die from vomiting, but right now I feel like I'm dying. And so I just need you to be on the phone, or I can't stop crying and I need you to come home, and I need some help. And it's not always, I don't always know what kind of help I need, right? Like, when you know, that's great. Like I said, you can teach people how to help you, but you don't always know, or at least I don't always know. And so sometimes you just have to let other people guide you and just say, please help me. I'm having a hard time.
Yeah, it sounds like you've learned to be vulnerable with people in your life and recruit their help when you need it. And I think that's, again, I'm so grateful that you have those people in your life that you can rely on to be there for you and to help to figure out how to connect the dots when it can be so isolating. I think just, going back to those survey results, I think what really, really stood out to me was this isolation kind of theme that came across. And, I'm hopeful that people listening in today have, loved ones that are invested and want to really recognize what this lived experience is for the patient and step in when needed. I know, America, you were saying, if you don't have the words, does that person have the words that might be able to step in and maybe even send a note to the doctor to ask them to ask you about how you're doing, as kind of a roundabout way to get connected. I think one thing about COVID certainly is that there are a lot more private mental health resources out there. So digital mental health telemedicine is so much more widely used. Even app-based therapies are also getting better and better. So there are some options out there. I know they're not robust options or enough options for everybody, but there are some there that hopefully, folks can get connected to.
I think everything you mentioned, specifically around COVID too, Dr. Panda, it really did change the game for access to teletherapy and those types of interventions that for a long time, the systems didn't really enable those. And now there are more opportunities. It's not, the one thing that solves everything. But even within our work for Mental Health America, we have a portal that's called MHA Screening. It's our National Prevention and Screening Program, which enables individuals to take any one of 11 mental health tests. And we created this for the reason that we wanted to remove the barriers, the confidentiality aspect. Everything is confidential. It's anonymous. Nobody knows you're taking a screening. But if you're struggling, you're not sure what to say, how to ask questions, you can take a screen and then you get immediate results. And with that, you can take a copy of those results to your doctor and say, I took this screening. It's a scientifically validated screening. I need help, and these are my results. It does require for you to be vulnerable, which is really hard for anybody. But it is a first step that can help guide you down a pathway of finding resources. For folks that are interested, you can access it at mhascreening.org. And it's all free, like I said. And within that as well, there are different resources like different worksheets and helping us to think through what are the actual feelings that I have, right? It's so easy for us to say I'm angry or I'm upset and I'm sad. But the dictionary has so many words in it that ultimately help us really frame our conversation differently when we start engaging in something more meaningful for mental health. I want to make sure that we're mindful of time, and I want to make sure within that we ask folks if they have any questions to please let us know in the Q&A. Naya shared that Mental Health America also has an Inspire page, which is a phenomenal way to get connected with folks, and that's something, Adriana, you shared. While we wait for some questions, I would want to learn from both of y'all. What are some innovative ways that people are connecting and finding community outside of family? When family isn't an option, when you really don't have those systems, where do you find them other than Inspire? What have you seen out there?
I'll share. I have found some really great support at my temple. Like I have found a couple of amazing I would call them new friends that did everything from like, they bring me like gluten-free matzo ball soup when I'm sick to like, I have this rule where I try to do one coffee a week with a friend. Like if it's a bad week and I'm like, I haven't gone out this week, I just try to stick to that. And so sometimes I can't do that. And that group has been really good about, why don't we just go for a short walk? Like you want to get your walk in anyway. And so let's do that. But I have found it through my religious affiliation. And then I literally found it through NPF, like the local NPF chapters, New York downstate and Indiana. I found some amazing resources through that, and friends that ironically are like people I can chat with on Messenger at 3 o'clock in the morning, because none of us can sleep right because of pain medicine or whatever we're taking. And you're not going to roll over and wake up your spouse if you're married, and you don't want to call your friends at 3 o'clock in the morning. So like, fellow patients that understand why you're struggling and are also up in the middle of the night or 4 o'clock in the morning because we can't sleep because we're sick or something. Those have been some of my most saving graces.
Yeah, I think you hit on a couple of things that I think are so important. Going back to this idea of positive psychology, I think two of the most kind of pillars of that are engagement and relationships, and how those can be really, really critical and important in thinking about wellness. And so, of course, relationships, you're right, we don't always have supportive family members. And I, certainly love the idea of patients, support groups, those, what a great way to find people that can really and truly relate. And again, going back to this world of kind of globalization, I think you might be able to find someone awake at 4 a.m. Who maybe it's their daytime, and you might be able to connect with people all across the world, utilizing some of those things, which I think is really amazing. But then also you mentioned your faith and your temple, and I think this relationship and engagement thing can be connected to other values that you might have, other things that identify you as this person that you are. Can you find people that are also interested in those areas of life? And again, this idea, Adriana, of commitment. I mean, you've committed to yourself to do these things every day or every week, and committing to these things that really and truly matter, as much or as little as you can, is really demonstrated to make really long-lasting, valuable change.
One thing that's really interesting is I was just thinking about, like, I used to be someone who volunteered a lot, and I still do, but I liked to volunteer in food pantries and like, packaging the food boxes and all of that. And our temple does a lot of work with one of the schools that's a little bit underserved and has food needs a lot, particularly around fall breaks or summer breaks. And I kept thinking, like, how can I do this? Like, I'm not strong enough to pack these boxes. I don't have the energy to deliver these things. I don't even have the energy to go to the grocery store and buy these things. And so I regularly get lists of things they need. And so I figured out a way to buy through Amazon, like Fresh Cart or something. I figured something out, and I had them delivered to the house. And then I called the person who was organizing. I was like, I can't drop them at the temple because I don't have the energy to drive. And she found someone else to pick them up. So it's kind of like that, where there's a will, there's a way, but you have to get super creative. And sometimes that's partnering with another patient and saying, you know, what do you think? Like, do you have any idea on how I could figure this out? And also I would say picking the people that support you in life, and in this journey. I have a particular family member that the other day was like, oh, I don't feel good. And I was asking how they were, and they had a cold, which I get, can take you down. And I said, oh, I'm having a rough day too. And they literally said something must be going around. And I was like, yeah, I don't feel like GI diseases are just flying around. Like, I don't think so. But they are a person who just has never really gotten it. And so you can't take stock in people like that. You have to just be like, maybe, and just move on with your day. But I don't want to sound, like I said, all Pollyanna-ish either. You know, I have really bad days, and we all do. And some of us have really bad months and weeks. And that happens with this disease. It's what comes with it. And it is sucky. It is very hard to manage. I am not going to say any different. I don't wish this disease on anyone. But the more support you can get in any possible way, I have found to be literally like my saving grace. It really has been what has continued to bring me through.
I appreciate that so much. And what you all are talking about and really reinforcing is this idea of peer support, you know, within the realm of mental health and anything. Living with pancreatic illness, diabetes, there are folks that are sharing similar experiences, right? Maybe not always the same, but there are aspects that once you start sharing your story and talking, you may find a point of connection. And Steve asked if MHA has thought about creating like some sort of peer support online forum, specifically with MPF, but we haven't, Steve, but that's not to say we can't. Right, we can explore what that could look like. I think Inspire is definitely a good place to start if you haven't ever reached out and explored that. But there are other places that you can create your own communities, everything from like Reddit to Discord to TikTok. You know, there are ways to connect with people. And even at the beginning of your journey, oftentimes it's really helpful to just listen. That doesn't mean you have to go in and share your life story. Start just by listening and seeing if something resonates with what others are sharing. And I would say most often something will stick. And you can keep coming back. And one day you may want to share your story. And part of that is normalizing your experience. But the other part is embracing the fact that you are a whole being. You're a whole person that has value. And I would love if we can uplift you in that way to help you feel that you are connected to people outside of your area, whether you are in a rural area, like George has mentioned, you're right, it's much harder to find support. But luckily, there are options out there. I also want to consider that it's really important that what we do as an organization, as Mental Health America and NPF, is that when you have opportunities to share your thoughts with us, to do so, right? NPF is a phenomenal community already. You guys are doing so much that helps individuals understand how to live with this illness, understand the ramifications of what it is, the impacts on your life. But Mental Health America has a lot of knowledge too. And we may not always feel as individuals that mental health is the place we want to dig into, but mental health impacts us all every day. So there are opportunities for you to engage with Mental Health America specifically in the next 2 weeks, from June 8th through the 10th, for instance. We will be having our annual conference. It's in person in DC, but there is also a virtual component, and it's free for anyone who registers. So if you're interested in just hearing about mental health and what we're looking to do and this kind of next generation strategic plan that we are launching, please join us. We can share it in the Q&A or chat. You can just find that at mhanational.org/conference. If you are interested, registration closes next Wednesday, so take advantage of that. But I'm gonna close out the session by asking one last question of our panelists. What would you say is one thing that on a daily helps you, Adriana, to move forward, even on the worst days that you're struggling. And Dr. Pandit, you as a professional, what can you tell us that can change the way that our professions are then helping individuals living with this illness?
That is a really good question. My first answer is obviously coffee. I mean, copious amounts of coffee, and I drink decaf, so I don't really understand why it helps me, but it's just a mental thing. It's obviously a placebo effect. I think the one thing on a daily basis is exercising physically and mentally. So whether it's meditation that morning or stretching for 15 minutes or going for a 1-block walk, exercising my mind and body every day has become a critical thing for me in moving forward, even on my worst days. And my days where I'm like bedridden, I still do like a 5-minute stretching or a seated yoga for 10 minutes, like something just to move my body and get my brain going.
And I think the question for me was about what to bring back to the providers, like the medical providers.
Yes.
Okay. I think for me, it comes back to this idea of the patient is an equal participant in the care. And so, bringing that mentality into those interactions, what you're experiencing, it matters. And it's not just about, what's happening, inside of your abdomen. It's happening not just inside your brain, but your connections with the life that you're living. And that, you're a person that's navigating life in a new way. So it's more so just, this mentality of you are an equal person here in having these conversations and talking about your treatment and talking about how to help you to move forward. And, steering conversations, as difficult as it may be, into those directions that maybe you haven't in the past, even as an experiment to see how it goes. Maybe you don't know how your provider would react to talking about mental health because you've never tried, and really they have a great list of resources. That's a possibility. So kind of being open to experimenting in those interactions, because we can't predict how they'll go. And people do surprise us. Yeah, I think that's.
Thank you. Thank you both so much. I think the conversation today is just a starting place for us to continue to do everything that we can. Well, thank you all again. And, if you can, please join us in our 3rd series, which will happen later in the year. We will send information out about that. But thank you, Adriana, and thank you, Dr. Pandit.
Thank you, America.
Yeah, thank you so much.
Bye, everyone.
Bye.